Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing using psychedelic-assisted therapy to address intergenerational trauma with Star Rose Bond. Star is a renegade psychotherapist, social activist, clinical supervisor for Pearl Institute, and co-founder of Life Camp. With a bachelor's degree from NYU and a master's from Columbia, Star brings 15 years of clinical trauma therapeutic services and experience serving marginalized, under-resourced, and at-risk populations, specializing in harm reduction and PTSD recovery. Now, before we get to Star, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one final reminder, as always, if you are a clinician and you'd like to learn more about how psychedelic medicines may benefit your patients, please check out the Psychedelic Medicine Association. It is our mission to get you educated and feeling comfortable discussing psychedelic medicine so that if you have a patient you think may benefit from psychedelics, you feel comfortable and confident having those conversations with your patients. You can check out the Psychedelic Medicine Association at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Star.
Hi there. It's really great to be here.
I'm really glad to have you on because I think we've probably discussed 15 different types of trauma, and we might have mentioned or alluded to intergenerational trauma, but we haven't done an episode solely focused on it. So I'm really excited to dive a little bit more in. And while people may have heard this term, intergenerational trauma, we may not have a full understanding of what it is. So if we could start off by having you describe what that term means.
Sure. I mean, it's a pretty broad term in a lot of ways, but to distill it down for the purpose of this conversation, when we start talking about intergenerational trauma, we're really looking at the impacts and ramifications, both psychological, spiritual, societal, indicators of what happens when an individual or even a community at large undergoes severe stress or trauma, and then looking about that, how that gets passed down intergenerationally. So even if you have a community or family member that's no longer pre-existing in an unsafe zone or an unsafe, environment, they still may be experiencing the impacts of this intergenerational trauma as a result. And we look at that from a physiological perspective. We look at it from a psychological imprint. It really kind of spans the nature of the human experience.
And what are some ways that it gets passed down? And I want to harken back to an episode we did with a few episodes ago when we were talking about the epigenetics of trauma. And so what I'm guessing is that there's both some kind of actual physiological means of getting passed down, but also more ways of like how one person treats the next affects how that person treats the next. Can you talk a little bit about those different mechanisms?
Sure. So the first one that you're speaking to is the idea of gene expression, that although the person, who is going about life now may not have necessarily been exposed to an acute trauma or an index trauma, perhaps being raised by caregivers, right? Or again, a community at large who had undergone a great deal of stress, they are still vulnerable to some of that gene expression. And that can look like something as like insulin resistance, or perhaps the ability for an increased sense of risk-taking behavior. Those are things, there's been a lot of studies shown that even individuals who are not living necessarily in unstable environments or compromised environments, you will find that their gene expression is being shown through as a result of coming from communities or environments where there was tremendous stress and trauma. On the flip side, you're also speaking to like that nature versus nurture, that environmental component. So being raised by a family member or a caregiver who has extreme trauma or a history of trauma is absolutely going to impact their psychological ability to be able to perform certain tasks, to be able to be present in a certain way. They have, may have limitations in terms of their ability to co-regulate with their child. And so that in turn creates this long span of what we see as intergenerational trauma and stress passed down. And more so, probably one of the most salient features is a disrupted nervous system. So this is what we see across the board with individuals with trauma, is that they have disrupted neurological landscapes, or interrupted, if you will, and their nervous systems are overactive. So when you look at that over the course of a lifetime or a lifespan, when you have a caregiver with a disrupted nervous system and they have been deemed the responsibility of child rearing, that's going to have huge implications on their ability to be available for that child in a way that's nurturing and efficient and successful over time.
Yeah, that makes a lot of sense. Can you describe some of the things? I think when we think about intergenerational trauma, we probably automatically think of some of the big things like, oh, somebody was perhaps a survivor of domestic violence or witnessed it in a parent, and then, that gets passed down. But what are some of the maybe less commonly thought of forms of trauma that one could experience that could still get imprinted enough to be passed down to other generations?
Sure. I mean, like from a macro level, we can even look at, like, let's start with communities at large. Do you know what I mean? When we look at, there's a really great book called My Grandmother's Hands, by Resma Menkena, I want to say is how you pronounce the name, or Menachem, I believe it is. And he really talks about sort of this both energetic and cellular imprint, across the globe. And we start looking at early stages of humanity and the ways in which we, have conducted violence, or there have been, we've seen slavery, or, things where there's been extreme trauma or stress across communities, and how that ultimately, again, has been passed down. So it's not necessarily on a smaller scale, but that's because it's considered in the past and something that, is kind of out of sight, out of mind. People don't recognize how much, of an impact something could have from generations prior to me, 2 to 3 generations, and how that impacts our genetics and on a physiological level. So you can look at it from, again, from communities at large, how that is imprinted. And then on smaller scales, I mean, again, oftentimes we just look at, like, living inside the patriarchy, living in a capitalistic system, right? You have the parents who are stressed out and, living paycheck to paycheck, and maybe just undergoing, like, if we take out the kind of big T, big trauma, and it's more this like chronic stress that many people in developing societies, and cultures are really undergoing on a day-to-day basis. And then we compound that with, like, let's just say this normalized mental health challenges that we see in our country around anxiety, depression, you know, let's call it unchecked trauma. You have this sort of chronic destabilization on a cultural phenomenal level that impacts our ability to be in the world in a safe way. So it's kind of like this, how should I say, this breeding ground of just simply not feeling safe in the world. Right now we are the most overdiagnosed, overmedicated cohort of human beings on the planet right here in America, right? So we're dealing with this sort of like chronic epidemic of people not feeling safe, not thriving, not feeling vital in the world. And yet we're here making policy, legislation, raising children, employing different activities in different public domains. So we're all participating in society from a very fear-based place as a result of this sort of like chronic epidemic, if that makes sense.
Yes, and I think, about certain people that I've encountered in my life, some who have seemingly to me experienced what if I had experienced would seem like, oh, a trauma that I would still be reliving every night, and they seem totally unaffected by it. Are there certain I don't know what like phenotypes or people or ways to know who is going to deal well with trauma and who it's going to affect more deeply?
Sure, that's a great question. So what I always tell people, because I supervise a lot of social work interns, and I always remind them, just because you have several students or several clients who've experienced the same trauma, don't make the assumption that they're all experiencing it the same reason. Or maybe you'll meet a client who's had trauma similar to yours. Don't assume that they have undergone the same emotional impact or psychological impact as you. The truth of the matter is that we are complex beings, right? We have so many different moving variables that go into our psychology, and that essentially indicate or play a role into how we respond to things. But what we do know is that there are certain vulnerabilities. So, for example, that's where we look at like compound trauma. When we grow up in an environment that has been destabilized, when we have already been exposed to, disrupted attachment, which is a huge one, early on in childhood, those leave you more vulnerable and more susceptible to compounded trauma moving forward. And what I mean by that is exposing yourself to high risk or at risk situations. And that could be domestic violence situations. It should be dysfunctional partnership. It could be, participating in activities that otherwise, jeopardize your sense of safety and health and well-being. I will say, out of everything in my clinical practice, what I could say both personally and professionally, the thing that I feel like people struggle with the most, or in terms of like adversity, or the thing that really causes the most impact and requires the most effort and work to come back around, is when we see very disrupted attachment early on in childhood, right? So severe forms of abandonment and neglect. That early childhood attachment is so critical to a sense of safety and well-being and belonging in the world. So when that gets disrupted early on, again, having worked with some of the most traumatized people on planet Earth, from like severe sexual violence to immigration, refugee, and asylee, components to, addiction and working in our corrections, the individuals that I see that really have to work for that resilience are the individuals that again suffered from that very, very severe neglect and abandonment early on in childhood. And I think that probably lends itself to the greatest vulnerability.
Okay, thank you for covering that. Now let's get into psychedelics. What, in your experience, have been some of the roles that psychedelics have been able to play in uncovering? Let's start with uncovering before we get to healing. Uncovering trauma that spans generations.
Sure. So for a lot of people, I can talk about this in a few different ways. When we look at intergenerational trauma, and I've been, if I've worked in BIPOC communities, a lot of what I've seen and what I've witnessed is part of working with the medicines. Number one, gives them an opportunity to re-engage an identity and a culture that has long been lost, you know what I mean, as a result of colonization and as a result of, acculturation and assimilation, that for so many BIPOC communities, there's an utter lack of like relationship to home and origin, you know what I mean, outside of like maybe perhaps storytelling or, relationships to grandparents, et cetera. But by and large, their culture, their language, their medicines have been lost, and so something that I've seen is this really, really beautiful sort of rekindling of spirit, of connection as a result of psychedelic medicines. It gives them access to this part of their identity that otherwise hasn't been there, which in turn lends itself to a whole new level of self-actualization and sense of belonging in the world. So that's just like one small component when working with certain communities. In other ways, it also extends itself to having a broader perspective of an experience. Psychedelics have an incredible way of essentially, in layman's terms, is having parts of your brain communicate that typically don't communicate. So that lends itself to different perspective, to insight, to a grander view of a situation, right? So Marianne Williamson often talks about how like a miracle is simply a shift in perspective. So for many trauma survivors, myself included, right, we get very fixed mindsets about the experience that happened. You know what I mean? The victimization, the traumatization, and even like the physiological triggers that are often accompanied by that. So psychedelics really offer an opportunity to expand, right, your horizons, your mental horizons, far beyond than what they've been capable before.
And how can they also be helpful in, I think I may have asked the question backwards, but how could psychedelics help uncover those intergenerational traumas?
Sure. So in terms of, do you mean more from like a literal sense in terms of going into?
Well, yeah, like, because sometimes we know exactly what happened in our lineage, and I'd say oftentimes we don't, right? We might have not had any conversations with, especially for people that perhaps adopted, they have no idea of their exact what happened to their mother or grandmother, that kind of thing. Communities might have an idea, but again, like, what could psychedelics help, like us, elucidate what may be the intergenerational trauma that we're dealing with now?
Sure. So a lot of times psychedelics offer an opportunity through imagery, right? Through unpacking some repressed emotions, repressed visions, things along the lines of that. So psychedelics, as mentioned before, have an opportunity, they lend itself to an opportunity to help you uncover parts of yourself that you otherwise haven't been able to see due to fear, right? Feared activation, or perhaps because the memories have been so repressed. So there is an element of, while undergoing a psychedelic or therapeutic psychedelic session, you will gain access to, again, perhaps a historical event in your life or visions that might speak to why you feel the way you do, why you might be experiencing some of the things you're experiencing. Like there's people that talk about having an intuitive sense about something and they just don't really know where it came from, or having a connection to something symbolic, like whether it be like a bird or a type of plant, and they just don't really know why. Psychedelics have given an opportunity to really help uncover maybe where that information or that lost data is really, surfacing from. So I would say in terms of that, that's how we would do.
Okay. And I know in your practice, you combine traditional trauma informed practices with modern psychedelic therapies like ketamine. Can you talk a little bit about how you combine those two to help people work through these traumas?
Sure. So, and I can answer it two parts to your previous question as well. So, one of the most awesome and beneficial ways, I would say primarily with ketamine and MDMA, for example, one of the greatest gifts those medicine have to offer is that they deactivate the amygdala, the fight or flight response, right? And so this is really provides a really profound opportunity to gain a human experience without the process of fear on board. And I think that that is a really, really important component when we talk about healing. Most humans, let's even take trauma out of the equation, just humans in general are operating oftentimes from a hypervigilant state. People with trauma, right, tend to do that at a much more expanded rate. So when you have the opportunity to deactivate that part of the brain and engage in dialogue and memory processing and discourse without the fear present, a whole new world sort of opens up. And so I think with ketamine and MDMA, and then employing trauma informed sort of practices, is that you really get to address both feelings, conversations, thoughts that otherwise would create a tremendous amount of anxiety and resistance. You get to now approach them without that present, which again allows you to dialogue in a very different way. Um, I think in terms of a trauma informed lens as it relates to psychedelic, it also challenges the conventional practice, which in my opinion can be somewhat antiquated, where in modern psychology, we oftentimes want to go in with a magnifying glass back to 1983 and ask the person, what's the worst thing that happened? And tell us about, this terrible experience. And this is often what deters people from engaging in therapy in the first place, because who the hell wants to do that, right? It can be re-victimizing, re-traumatizing. And so when you can function from a trauma informed lens, you do gain an understanding that I've been working with people for 15 years now. Very seldom do I have a client tell me the nitty gritty of their traumatic event. I don't need to know the information, and it's not necessarily relevant for their healing. I can gain an understanding by a general sense. I have a history of sexual abuse. Cool. That's kind of like all I really need to know oftentimes. And I can gain an understanding about their nervous system profile and some of the beliefs that they're working with. So from there, you can take a trauma informed lens and develop interventions and approaches with that client that don't require the re-traumatization of going back into those moments or into those experiences from an anxiety ridden place. And so psychedelics lend itself to a larger conversation, a softness within those dialogues, and an opportunity to really sort of gain insight into an experience that otherwise felt not only scary and victimizing, but oftentimes hopeless as well.
Yeah, I think the softness that you just referred to, that harkened to me about the trauma informed practices. Is that part of what it is to be trauma informed, is to go at, like you said, their history of trauma, but in a way that is not so activating?
100%. And I think in a nutshell, what I will often tell people, like there's two ways that from an almost like non-clinical jargon, but the way I like people to understand trauma informed work is instead of looking at a person and being like, what's wrong with you? A trauma informed approach is looking at a person and asking the question, what happened to you? So that's the big difference right there. And I think that what you're doing in these spaces is that you're really taking in the whole person, right? And you're already looking at them from a state of wholeness. Instead of looking at them through a state of symptomology, you're looking at them from a state of wholeness, and you're willing to engage them from a place of, I already see you in your greatness. I already see you in your fullness and the love, but you have created limitations based on some of the experience that have occurred. So that's part of the work in the psychedelic medicine, is to help remove the psychological, perhaps barriers that are in place that inhibit a person from living in their already pre-existing greatness, versus you're coming in as a broken individual with all of these symptoms that we have to manage.
And and I'm thinking here, like somebody goes through, like you said, ketamine being an example, maybe they've gone through the sequence of ketamine therapies and then they've done the integration. Um, what I actually, I'm going to ask this in a different order, but first, before I ask what happens when you have to go back to maybe the family that has led to some of the intergenerational trauma, what about the fear? You were talking about fear a moment ago, of uncovering something in your history or the history of your immediate family or ancestors that is going to be one, perhaps very uncomfortable just to think about, or two, that may make your relationship with other family members uncomfortable from that point on. How do
Okay, so
you, yeah, address that?
sure. So are you speaking to the notion of, like, for example, gain this insight into your new way of being around this trauma or this experience? How does that then impact, the relationships that you have moving forward with these people?
Well, say you uncover, I mean, and I guess this is maybe like let's say you uncover or become aware of a trauma that happened to your one of your parents by one of maybe your grandparents, but your grandparents are still alive and you have a relationship with them, and then like I think some people may have the fear of finding out things, going into psychedelics, finding out things that may then affect their relationships with people going forward.
Sure. So I can only speak to this notion from a very subjective standpoint, quite honestly, because I find that psychedelic medicine and journeys itself are so deeply personal, and how each person chooses to navigate as well as integrate their medicine experience is really entirely up to them. Um, Part of psychedelic medicine is this idea of expanding into the mystic, into the mystical, right? And so when we uncover this type of information, as scary as it may be, or as alarming, or even unexpected, there is an element of utilizing psychedelic medicine to tap into a sense of spiritual meaning and spiritual purposefulness. So what I mean to say by that is that even if you do discover these things, or you find out that there was, perhaps sexual abuse, occurring, in with, amongst your grandparents to your parents, and that makes sense as to why they lived the way they did, there's an element where you can then use these psychedelic experiences and integration to start to make meaning around this sort of intricate fabric of divine existence. Like, we can't always express or understand why things happen the way they do, but we can start to make meaning through a spiritual understanding, which in turn lends itself to a sense of ease and comfort. I mean, this is why so many people lean towards religion, in a lot of ways, to make sense of the world. And part of what psychedelic offers is a mystical expression or a mystical understanding around this sort of divine orchestration, because we can't always, in our very logical, pragmatic, fear-based minds, make sense. Why could this happen, or how could this have happened to us? And and almost make medicine out of that poison. It can feel very difficult to do that in these constricted, triggered states. But psychedelic medicine offers, again, a sense of internal expansion to be able to think outside of our limited views in that way, and make meaning and find meaning out of otherwise very, very complicated, difficult circumstances.
That makes sense. And something that came up again while I was picturing you having patients going into these sessions, perhaps uncovering things. I know we've talked on previous episodes about recovering memories, the potential of creating new memories. Are they true? Are they not? That leads me into something that I know we had wanted to discuss, which was some ethical and practical considerations for those who may be guiding clients through these experiences that are aimed at resolving this deep-seated intergenerational trauma.
Sure. Yeah. So, I mean, I'm a huge proponent. I'll be honest with you, in full transparency, I have a lot of mixed feelings around this subject matter in terms of guides and facilitators. Um, I'm at heart, I'm an anarchist. So I actually really challenge a lot of regulation, you know what I mean, as a whole. And then as a trauma informed practitioner, I also reserve a lot of opinion and insight around, like, the safety of the people that we're serving, because I've seen a lot of terrible things happen with, supposed facilitators or guides who have conducted, situations or, sessions as such to help unpack people's trauma, that didn't really have any clinical expertise, and certainly didn't even have an indigenous origin to be able to support their guidance. You know what I mean? It was sort of like a hodgepodge of skill sets that were like, let's just see how this works. And I've worked with a lot of individuals who have come to me after going and, doing psychedelics, doing medicine in some capacity or in some form, and getting so blown out, right? And not felt supported, and not had healthy or ethical integration, that it actually did more harm than good. So I say that to say that when you are going into these experiences as a facilitator, whatever your background is, it is of the utmost importance that you are hyper cognizant and hyper aware of the harms that can be caused by not being aware of the ways in which you can navigate somebody else's trauma as it shows up. How does it affect your trauma when it shows up as a practitioner? Because everybody has experiences through transference and countertransference, right? What to do when somebody becomes so dysregulated in a psychedelic experience. How do you support them appropriately, right? How do you not recapitulate traumas from previous experience, whether that be through physical touch or, verbal assertion? Like, there's so many components that we really want to be aware of. And I think that on one hand, we're in an unfortunate state where, or fortunate and unfortunate, where yes, psychedelics are being normalized for mental health, which I love. And then on the flip side, there is sort of like this race to the finish line to see how many people can be involved in this, because it's both lucrative and exciting. And we kind of have a mix of individuals where there's a pocket of humans really being served, and profound effects are occurring as a result of this help. And then we're also seeing a lot of harm being done by people who are untrained, ill classified, going in and using these medicines in really egotistical, inappropriate ways.
Yes, thank you for putting a point on that. And we will stop here and remind everybody to check out Shine Support if you have had a negative psychedelic experience or experienced any um, adverse treatment by a facilitator. Shinesupport.org, I believe. We did an episode on that. We've also done a number of episodes on how to choose a qualified facilitator / retreat center. So please check out all of those because this point is not minuscule. This is not a small amount of people that have negative experiences. If you also check out the Jules Evans episode about the Challenging Experiences Project, these are very powerful medicines, and you want a qualified, skilled, trauma-informed guide, especially, like you said, if you're going to be doing intergenerational trauma work. And I think that might be one of the things that's difficult about psychedelics is you don't know what kind of work you're going to be doing when you go in, right? You can't say like, oh, I'm not going to go discuss my trauma this time. This time we're going to talk about my anxiety. And oh, well, what's at the root of that anxiety? Here's your trauma, right?
100%. I can't tell you how many people come to me. They're coming to me to talk to me about, again, their depression that's, resurfacing, or they're coming to talk to me about parent-child relationship. And then all of a sudden, you know what I mean? We're knee deep, and in the medicine session, and they're talking to their grandmother, from, multiple generations ago. So it does happen.
Yeah. And on that topic, are there certain set of extra skills that people might want to look for if they specifically are seeking out somebody who hopefully has these skills? Is this something that's taught in a lot of the therapy programs, therapy and psychedelic therapy? Is this common, or is this kind of a niche thing? Like, what should people be looking for in a therapist?
Sure. So definitely, again, you're always looking for somebody who, again, and trauma informed is one of those like trite, loose terms that's been thrown around. So you really want to
Yes.
be individual around like, what does it mean when they say that they're trauma informed? Um, and I think that a lot of times what you're looking for is a relational based practitioner that really honors that the medicine sessions are facilitated under the guise that you're the captain of the ship. So whoever I'm serving, right, and working with and holding space for in that way, I am going to take a non-directive approach as a clinician. And truth be told, as a regular therapist or as a coach, I'm very directive. But in medicine sessions, I'm very non-directive. And so what that means is that I honor that the medicine, right, is going to activate, unlock, unearth your inner wisdom, at which you will be the guide. You will help facilitate the conversations, the space, the level of therapeutic processing. So you really want to look for a practitioner that honors the fact that you have everything that you need already, and the medicine is here to facilitate or operate as a vehicle to help unlocking some of these pieces, and the practitioner is simply there to hold space for those uncoverings. Okay, that's a primary function, because a lot of people go into these medicine sessions with facilitators who believe, and they're put on pedestals, they believe that they have the answers, right, and they're the ones serving the medicine, and that they have all these just deeper understandings on what they think is best for that client. That's not how it works. Okay, so really finding a relational based practitioner who honors the inner wisdom within an individual. A lot of people work with parts work, or inner child work. I do incorporate CBT in a lot of my integration work because I'm really always trying to maximize and capitalize on the neuroplasticity that's occurring in between the medicine sessions. And I love CBT for that. Mindfulness based practices, different types of breath work, holotropic breath work, I know is a big component that people use. So you really get to, depending upon the practitioner and what they've lent themselves to, they're going to bring their own flavor of modalities that they love. A couple of my colleagues are really big into EMDR and they incorporate that into their psychedelic sessions. So it really depends. But at a minimum, you want a relational based practitioner.
Okay. Thank you for that. And something that you talked about in integration, if like we were talking about, if something comes up related to family members that are still alive, and it may not be like, oh, like you said, I uncovered that there was sexual assault or something like that. But what if there's just other things that you bring up? Do you often recommend, and I know you say person by person, but do you recommend sometimes that they discuss that with those people in their close family? Like, hey, have others of you experienced these kinds of feelings, or did this thing happen? Am I and imagining it? Like, how often do you advise, or what types of scenarios would you advise them having conversations with their other people that have experienced similar traumas to them?
Sure. So I think that really comes down to like where and at what level do you want to do repair with family members, right? So for example, like you might have a very dysfunctional family where abuse, right, and high levels of stress were very pervasive. And so it doesn't necessarily mean that that's something that you're going to want to engage in, because not everybody's going to be in a therapeutically receptive mode to be able to handle those conversations. So I often say, if you do want to bring this up with somebody else, you're going to want to do it in a way that is brought to the attention to the other person in maybe a mediated space, right? You really want to honor these spaces in like a therapeutic space as a place to process that. It's very rare that somebody leaves a therapeutic setting and goes and talks to their brother or their cousin about perhaps this type of trauma and it goes well, to be quite honest with you,
Yeah.
because it can often be retriggering for the other person, and the individual might not have the tools or even the ability to self-regulate through those conversations. So sometimes it can just be helpful to be in these mediated spaces.
That makes a lot of sense. There's so much to unpack with it. I really appreciate you being here with this, bringing these conversations and these tools to listeners. Is there anything that I haven't covered that you think would be important on this topic?
um I think the thing that I always mention in every interview that I do, trauma is such a buzzword right now, and people, identifying with all the different ways that it has impacted a person, negatively. And I just want you to know that all of those experiences are valid and the healing possibility is also there for you. Like, I just want to be really, really clear about that, that as much as we think that healing isn't possible or that there's so many different variables that, you know, um, leave us outside or exclude us from the possibility of healing, everybody has the capacity to heal. Like, it's genetically predisposed inside of us to thrive and heal, much like when we drop seeds into the ground and grass grows, or an acorn into the ground and a beautiful oak tree grows. Like, we have that same predisposition inside of us. And so even in your darkest hour, when things feel scary or um, hopeless, that I just want you to know that the capacity to heal is always available. Humans are absolutely incredible self-healing beings. So I always like to include that.
That is a beautiful place to end. I really appreciate that. Star, will you let people know where they can find out more about you and your work?
Absolutely. You can find me on Instagram at Star Rose Bond, all one word, or you can go to my website at www.starrosebond.com.
Excellent. Well, thank you so much for being on and for sharing this conversation with us.
Thank you.
And for everybody else out there, until next time.